Across the European Union, there are significant inequalities in vaccination. While the media often emphasizes vaccine hesitancy, there are other health system-related reasons why individuals may not receive vaccines, like exclusion from population registers or culturally inappropriate messaging about vaccines. In Greece, for example, the measles-containing vaccine coverage is 55% lower in migrant children as compared to other Greek children of the same age. Similarly, despite there being an effective vaccine, each year, HPV still causes 33,000 cases of cervical cancer in the EU and 15,000 deaths. In the Netherlands, studies have found that adolescent girls with parents of Turkish or Moroccan origins had substantially lower HPV vaccination rates than girls in the general population. In both cases, specific health system barriers to vaccination are likely contributing to these dramatic differences. But how can we adapt our health systems to reduce vaccine inequalities? River EU will improve access to vaccination services for children and adolescents in 8 communities whose access to vaccines against MMR and HPV has not been ensured. 5 minority or ethnic communities have been selected due to relatively low vaccination coverage. Other communities, however, have been selected as empowering examples due to their unexpectedly high vaccination rate. Working with all communities, River EU will collect evidence on different barriers and enablers to vaccination. This evidence will be used to adapt and design health system interventions, which will be implemented and evaluated in communities with low vaccine uptake. Training materials to improve cultural competency of health professionals and health students will also be developed. Lessons learned will be translated into guidelines for policymakers to improve the performance of vaccine programs. They will be linked with the World Health Organization's strategies. Working closely with researchers, policymakers, health professionals, and communities across Europe, we can expand the life-saving protection of vaccines for all.